Welcome to the FCICA product webinar series. Thank you for joining us. We are pleased to have Kevin Kennedy, the CEO for the Small Association Leadership Alliance, with us today, presenting the SALA Healthcare Program. Kevin Kennedy is the CEO for Small Association Leadership Alliance. Kevin has more than 25 years of diverse experience, having worked for more than 24 associations, professional societies, and nonprofits in a broad range of fields, including technology, architecture, education, healthcare, and finance. Kevin guides SALA members on general association management, finance and accounting, affinity programs, virtual office development, HR and employee benefits, chapter development, and board relations and governance. Welcome, Kevin. We're excited to have you. I'm going to turn the controls over to you.
Great. Thank you, Christine, and thank you, Billy, and welcome, everyone. I'll take you through the slide deck here. It'll probably take around 20-25 minutes or so, and plenty of time for questions at the end. Pardon me. Like Christine said, I'm with SALA, with the Small Association Leadership Alliance, and we're going to be talking about our healthcare program today. I'm going to apologize in advance for the dog if he barks. I am working at home, like I imagine so many of you are as well. But the program itself is really our effort to simplify just the ever-increasingly complex healthcare that we have. There's a great choice of affordable healthcare options for folks to look at. That third bullet down has gotten a lot of attention over the last couple of months. That's actually a survey from the Kaiser Family Foundation from the end of 2017, where 43% of small businesses at that time were offering healthcare to their employees. Certainly over the last year, I imagine that has shrunk a bit. Also, the second bullet from the bottom there, on average, folks are able to realize a savings of right around 60% compared to what they would pay for traditional insurance on the state exchanges. And then lastly, we do survey participants in the program annually. And our survey from last year showed that 91% of participants were either very or extremely satisfied. But what we are talking about today is an alternative approach to traditional health insurance. When folks enroll, they first choose a plan from Apex Management. Those plans are really focused on preventive care. There are two choices to choose from, and I'll go through the details, including the pricing towards the end. Folks would then pair that with a membership to Sedera, and Sedera's medical cost sharing, and I'll spend much of the next 15 minutes or so talking about medical cost sharing, as it may be a new concept for many of you. It was for us when we first started talking with them back in 2017 or so. So our healthcare and the program in general really falls into these three components. There are large costs, which we refer to as needs. That's really where your Sedera membership is focused on, and that's the significant medical events we all have at different times in our life. Could be surgery due to an accident, maybe an ER visit, maybe some diagnostic imaging. But like I said, the significant medical events that we all go through. Then there's small to medium costs. That's more of the run-of-the-mill type stuff we all have. A cold, a sinus infection, a flu. And then there's preventive care. And preventive care is everything from childhood immunizations to your annual physical to colonoscopies and mammograms and everything in between. The preventive care items are really the items that the Affordable Care Act mandated and defined that we all have some years ago. And I'll refer back to this slide a couple of times as we go through. But like I said, I'm going to spend much of the time talking about Sedera and talking about medical cost sharing. Medical cost sharing has been around since the 1980s, but it's really had a foothold with religious groups. Different churches and congregations over the years have formed organizations through which their members and parishioners could share in each other's expenses. Sedera's parent company is actually called the CARES Group, and the CARES Group is a medical bill negotiating company. And they're the company that many of the religious organizations have used since the late 80s, early 90s to negotiate their larger bills. But when the CARES Group saw that all of our healthcare costs were increasing at just an unsustainable rate and continuing to do so, they formed Sedera. Sedera is built upon the same best practices as the religious organizations, but does not have any religious affiliation or requirements at all. It's not a religious organization. I think this slide illustrates pretty well why we're all here, and I apologize. It looks like some of the fonts got a little wonky on the bottom. But over that 10-year span, you see that total healthcare insurance premiums have increased on average by about 55%. The employees' portions of those premiums have increased about 70%, and all of our wages have increased about 19%. So it's really what we all know. And it's simply that the cost of healthcare continues to rise at just an unsustainable rate. And as you can see there, we refer to it as the unsustainable squeeze. Someone told me, actually probably a few months ago now, that the only item that has risen at a higher rate than healthcare has been the cost of college. But I think you'll find that our objectives are really in line with your objectives, and that is enjoying the freedom to choose. I'll speak about that a bit more on the next slide, but Sedera members, they can go to any hospital they like or doctor they like to get the care that they need. Lowering monthly expenses. When I get to the pricing of membership of the program in general, I think you'll find that for virtually everyone, it will lower their monthly contribution amounts. And for most of us, it will also reduce our out-of-pocket costs or our large medical costs. And really, I think that's everyone's goal, to maintain the same level of great health care, but just reduce the amount that we're spending on it. Like I said, medical cost sharing is unique. You see at the top there, every member is a cash pay patient. So with Sedera, you do not get a card like you have currently with your insurance company. If you are at the hospital, for example, they ask you how you would like to pay or ask for your insurance, you would say, I'm a cash pay patient, please bill me. What that allows, though, is what you see at the bottom there, which is freedom from networks. Sedera's network independent. All cost sharing companies are. Because you're a cash pay patient, you can go to any hospital you like or any doctor you like to get the care that you need. One last item on this, and that's on the left where it says sharing is on a per need basis. I'll refer back to that a couple of times, but rather than having an overall annual deductible that you and your family would have to meet before your insurance kicks in, sharing is on a per need basis once the member meets what's called their IUA, or initial insurable amount. And I'll talk about that in a bit more in just a couple of slides. One last illustration here. Sorry about the dog, everyone. This just shows the adoption rate of medical cost sharing over the years. You'll see that uptick really starts around 2011, 2012, when all of our healthcare costs really started to increase at just an unsustainable rate. Folks started looking for an alternative. By the end of 2017, there are more than 1 million members sharing more than $1 billion annually. That membership number now has grown to closer to 1.5 million or so. But let's talk about the medical cost sharing and how it actually works and what is a need. A need is one or more medical expense caused by a single accident or illness. I apologize for the fonts here. It looks like they got a little wonky, maybe in the conversion. But if you look at the illustration here on the left, this is someone who broke their leg, right? So they would have costs for, say, the ride in the ambulance, the stay at the hospital, surgery, diagnostic imaging, prescriptions and physical therapy, and all of these costs, whether they occur over a period of weeks or over a period of years, all of those costs are just part of that one need. Now, the member's responsibility is that IUA that I briefly mentioned just a few minutes ago, which is the initial insurable amount. That's what you're agreeing to be financially responsible for if and when you have to use your membership. As you can see that there are 5 levels to choose from: 500, 1,000, 1,500, 2,500, and 5,000. And so a quick example here to make the math easy. Let's say the broken leg and surgery costs $10,000, and you had selected the $1,000 IUA. You'd be responsible for paying that first $1,000. The balance, the $9,000, will be shared through the community and paid accordingly. And I'll talk through the logistics on how that works in a couple of slides. Now, if you enroll as an individual, you're responsible for the first 3 needs in a calendar year. If you enroll as a family, you'd be responsible for the first 5. As a practical matter, we all have far fewer than that in a calendar year, hopefully. But if you did have a 4th as an individual or a 6 or more as a family, it'd be at a $0 IUA. And that's actually under the limiting your out-of-pocket cost area there. So if you're looking at this and trying to figure out what your maximum exposure is, or what your maximum out-of-pocket might be in a calendar year, myself, for example, I enrolled in 2018 as an individual, and I chose the $1,500 IUA. So my maximum exposure, if I had 3 needs in a calendar year, would be $4,500. If I'd enrolled as a family, it would be $7,500, or 5 times that $1,500. The 2 most common IUAs that people choose are the $1,000 and $1,500 IUA. But again, people choose the $500 IUA or the $5,000 IUA. It really comes down to what best fits them and their family. Here's a real quick, real-life example. This actually comes from the CEO of Sedera. Prior to joining Sedera, he and his family were on traditional insurance, of course, with a $5,000 deductible. They had a young son with a persistent ear infection, so After a series of antibiotics and booster injections, they went to an ENT who inserted tubes into their son's ears. On the left, I apologize for the font, you can see that their out-of-pocket cost was around $2,500, with co-pays and then the cost of the surgery being around $2,100. On the right, of course, if they had selected the $500 IUA, their out-of-pocket cost would have been just that $500. Now, the sharing works really in two ways, if you will. One is a situation like this where it's a scheduled surgery. The member would reach out to Sedera, let them know what's going on in this case, and let them know that whenever it might be, say 2 weeks from tomorrow, their son was going into this procedure. And they would have a need, to be shared with the community. Given the relatively low cost of this procedure, Sedera probably wouldn't do anything more. Just wait for the family to get their bills and upload their bills to Sedera. But let's say that this procedure was something much more, and let's say the cost was $250,000. If that was the case, Sedera, through their parent company, the CARES Group, would most likely reach out to the doctors and reach out to the facility and look to prepay for that surgery if it made sense financially. And during our own due diligence on the program a number of years ago, we actually reached out and spoke to a number of hospitals in the country and asked them through CostSharing if someone prepays and essentially pays in cash, which is what would happen here, and what does the hospital do? We were actually surprised to hear all three hospitals gave us the same answer, which is they would automatically discount the cost of that surgery 50%. So oftentimes, through prepaying for surgeries and other needs, Sedera, through the parent company, can save significant amounts of money. On average, Sedera is able to save the community between 47 and 53% on the overall cost that the community incurs. Now, the other way cost sharing would work would be, of course, if this was an emergency situation. I'll use the broken leg scenario again. Let's say you broke your leg, you need care, of course. If that's the case, you go right to the hospital, right to the doctor, get the care that you need. When the hospital or facility asks, like I said, sorry about the dog, stop. How would you like to pay? You would say, I'm a cash pay patient, please bill me. And when they send those bills to you, you'd be responsible for uploading those to Sedera. On average, checks are sent to members in about 3 weeks to pay for their needs. If it's a larger need, let's say it was the $250,000 need I just explained, it could go on to 4 weeks. But the member has the same needs coordinator the whole time. You're in the loop the whole time. And when we do our annual survey, the needs coordinators at Sedera actually get among the highest remarks. They're really just fantastic people, and they will walk you through the entire process. Now, there are some nuances to the program. These next three slides really help illustrate if it's a program that would work for you and your family. And I'll let you know where we get the most questions as well as I go through the slides here. This first slide I will interpret for you, and that is what members have to commit to when they sign up. One is you have to commit to strive to live a healthy and balanced lifestyle. Obviously, making smart choices like diet and exercise can greatly improve one's quality of life, but it also keeps us all healthy and keeps us out of the hospital and out of the doctor's office. Now, striving to live a healthy and balanced life is not legally binding in any way, but it's something that members have to commit to do. You also have to commit to not use illegal narcotics and not to operate a vehicle while intoxicated. So what does that mean? That means if you're operating a vehicle while intoxicated and you got into an accident and you had bills associated with that, you were hurt, those bills could not be shared with the community. The principle there is that the community should not have to pay for someone's illegal or reckless behavior. Now, other cost-sharing entities, like I mentioned, with the religious groups, they have other restrictions on reckless behavior. Like you can't go skydiving, and they have other religious requirements included. But with Sedera, it really comes down to the use of illegal narcotics and driving while intoxicated. Also, tobacco users are certainly welcome to join. Everyone is. But there's a $75 surcharge per month per household. So in other words, if you're a husband and wife and you both smoke, it's only one $75 surcharge per month, not two. Lastly, the fine print that is down there at the bottom. For tobacco users over the age of 50, there is a $25,000 per need sharing limit for the top 4 disease states associated with tobacco usage, which is heart disease, stroke, COPD, and cancer. Medications. There are basically 2 types of medications we all take. Those that are curative and those that are for maintenance. Curative medicines are medicines we take for a period of time, right, until we're cured. There's an end date at which point we stop taking those medicines. So it could be antibiotics or pain meds or chemotherapy drugs or whatever they are. The cost for the curative medicines are shared through Sedera and part of that IUA math that we just went through. The other type of medicines many of us take, myself included, are maintenance medicines. Could be for high blood pressure, high cholesterol, and overactive thyroid is a very common one. I take them for rheumatoid arthritis, but these are medicines we take daily or weekly or however they are prescribed. And in my case, we'll do so for probably the rest of my life. Now, if you're a member of Sedera and you enroll and it's a new diagnosis, let's say when I enrolled in 2018, I was diagnosed this year with rheumatoid arthritis. If that was the case, for the first 120 days, the cost of my medicine would be shared through Sedera and part of that IUA math. My rheumatoid arthritis I've actually had for many, many years, and so it's a pre-existing condition for me. So I've actually been responsible for the maintenance medicine since I enrolled in 2018. Now, there are a number of great third parties out there, GoodRx, CleverRx. I'm sure you all, wherever you are, see plenty of commercials for a new prescription savings program almost every time you turn on the TV. I will tell you that a lot of these third parties have fantastic discounts on drugs that are very commonly prescribed or in a generic form. For example, high blood pressure, cholesterol medicine, things of that nature. You can often get to the third parties for less than $10 per month. Many of our members do use these third parties like GoodRx, Liberty Benefits, CleverX, and others. The Apex component of the program, which is the first component that I mentioned when I started this presentation, also has a prescription drug program. That's how I get my prescription drugs filled. That's how the majority of folks in the program get their prescription drugs filled. So when I get to the Apex portion of the program, I'm going to revisit prescriptions a bit more, and I'll probably refer back to the slide as well when I get there. Pre-existing conditions. Now, a pre-existing condition for Sedera is defined as anything you've had a symptom of or received treatment for in the prior 36 months to joining. Well, in my case, when I enrolled, I had to disclose, of course, that I had rheumatoid arthritis. Now, the restrictions come into place when you need to use your Sedera membership, which is key to know, because with my condition, I do have ongoing care that I need. So through the Apex component, when I go to my rheumatologist, that's a $50 copay, and that's covered. The blood work I have to get done a few times a year is also a $50 copay, and it's covered. And then, like I said, I get my prescriptions filled. And I'll talk much more about Apex in a few minutes. But what Sedera is saying on the Sedera side is that if your pre-existing condition results in a need, let's say that my rheumatoid arthritis meant that I had to have surgery. If that happened in the first year, I would be 100% responsible for the cost of that surgery. If it happened in the second year, up to $15,000 would be shared through the community. The balance would be my responsibility. In the third year, up to $30,000 could be shared. The balance would be my responsibility. After that, it's fully shareable. So with my condition being chronic, it's something I've had for forever, I'll have for forever, but there's nothing on the horizon, if you will, that would have precluded me from joining. So like I said, I signed up in 2018. But let's say, for example, that when I went to sign up, I was going through treatment for cancer. Or let's say we went to enroll as a family and my wife was currently pregnant. Both of those would obviously be very large pre-existing conditions and would cause, quite a financial burden for us in that first year, maybe even into the second year. What we generally tell folks is that the program itself is a good option for probably 75 or 80% of us to consider, including those of us with pre-existing conditions, but it's not going to be the answer for everyone. By far, the most questions we'll get about the program is actually on this slide and with pre-existing conditions for folks. Towards the end of the slide deck, you'll see our contact information. It's also on the FCICA website, of course. If you have questions about pre-existing conditions and how they work, or just want to talk through the program a bit more, please reach out to us. The last thing we want, obviously, is for anyone to enroll, not understanding exactly how the restrictions work, and all of a sudden be stuck with a large bill, which is exactly what we're all trying to avoid. So again, by far, the most common question we get is actually on this slide. The second most common question is on prescriptions. So like I said, I will talk about that a bit more, but please do reach out to us if you have any questions on how pre-existing conditions are handled. Also on the FCICA website, there's a wealth of information on this, and you can certainly check it out there. But like I said, please do reach out. Now, included with everyone's membership is a subscription to Teladoc. Teladoc is the largest provider of telemedicine in the U.S. Telemedicine has certainly been in the news quite a bit this year with COVID. Telemedicine, if you've not used it, it's exactly what it sounds like. You connect with a doctor virtually over the phone or through your computer. You can do it from your house, your car, your office, wherever you might be. And doctors, like you can see there, are available 24/7, 365 days a year. Telemedicine is great for a few reasons. One is, if you need to talk to a doctor at 2 o'clock in the morning, for whatever it might be, you can talk to a doctor at 2 o'clock in the morning. And that doctor can also prescribe medicine. So if you need, let's say you're sick and you need a Z-Pack or something like that, you can call up the folks at Teladoc. They can send a prescription to your local pharmacy, pick it up when you can or have it delivered or whatever you're doing and go along your way. Well, we had a woman recently who had an eye infection. She used a video call service with Teladoc. They diagnosed what it was, sent the prescription to her pharmacy. She picked it up and, like I said, was on her way. Last year, more than 40% of the folks who enrolled in our program used Teladoc, and every Fortune 500 company in this country actually now offers telemedicine. And the reason for all this is it's a money saver and a time saver. A time saver, like I mentioned, because you can connect with a doctor from your car, your home, your office, wherever you might be. So rather than going down to urgent care or to your primary care doctor, you can simply do it when it best suits your schedule. Also, it's a money saver because there's no additional out-of-pocket costs when you use Teladoc. There's not a copay or anything like that involved. The cost for Teladoc has been built into your monthly contribution. Also included is Second MD. Second MD is a great way to get a second opinion from anything you're going through, medically speaking, of course, and from some of the nation's top doctors that practice at centers of excellence like Johns Hopkins and the Mayo Clinic and elsewhere. Second MD is there for two reasons. One was there was a study that showed the average physician was 13 years behind on his or her continuing education. The Second MD simply makes sure that we all have access to the most up-to-date information. Maybe there's a new medicine, maybe there's a new procedure, maybe there's something less invasive. Second MD is also there because if you're having an elective procedure, Sedera requires you to get a second opinion, and you do that through Second MD. And it's not a heavy lift. It's usually handled in an email or two, or maybe a phone call or two. Also, what's important to note is that opinion issued by the folks at Second MD, it's not binding. You and your doctor make the decision on what's best for you and your health care. So that's it for the Sedera component of the program. Again, Sedera's really focused on those large costs or needs, as we call them: surgery due to an accident, hospitalization, maybe diagnostic imaging, maybe it's just an ER visit for something. They then have the other ancillary services like Teladoc and Second D that will help with the small to medium costs. But now I'm going to switch gears. I'm going to talk about Apex. There's no relationship between Apex and Sedera. The enrollment process, even though it is actually pretty seamless, when you enroll, you're actually enrolling in both Sedera and Apex. They are two separate companies. But Apex is really focused on preventive care. They do have the Advantage plan, which I'll discuss, that has a structure for ongoing care that folks may have. But the first option for Apex is the basic plan. And to be honest, it is just that. It's a basic plan. It covers all of your preventive care needs 100%. So as you see there are 21 services for adults, 28 for women, 31 for children. If you recall back to when the IRS was issuing penalties, it's because folks did not have adequate preventive care coverage. So even though those penalties have gone away, some states have implemented them, like New Jersey is one, and I know a couple others are looking at it. The point here being that it meets the federal requirements and also the state requirements for preventive care, so there are no penalties involved for folks when they have either of the Apex options. With the basic plan, though, it covers all your preventive care 100%, but that's it. If you have the flu and you want to go to your doctor rather than using Teladoc, you would pay for that office visit. Also, the basic plan does not have any prescription drug coverage. So if you're on the basic plan, many of the folks who are, they use third parties like GoodRx and CleverRx that I mentioned earlier. And what's important to note here, sorry, I didn't advance the slide, is that the basic plan does meet the federal government requirements for a health savings account. An HSA, as you may or may not know, is a great way to put away tax-free dollars to be used down the road towards any future qualified medical expense, such as dental, vision, prescription, doctor visits, and also to pay your Sedera IUA. For this year, limits for an individual were $3,550 for the year. Families were $7,100, and those over 55, an additional $1,000. Most folks who do sign up for the basic plan already have an existing HSA, and you can keep your existing HSA. If you need to set up a new HSA, there are literally hundreds, if not more, banks on the internet and probably local to you that set up HSAs for you. It's a very, very easy process. To be honest with all of y'all, if I did not have rheumatoid arthritis, I would be on the basic plan. I'd take advantage of the health savings account. Also, I did mention briefly that the basic plan does not have prescription drug coverage, and most folks use those third parties. Just to reiterate, a lot of those third parties, like GoodRx and CleverRx, they have great discounts on very commonly issued drugs. So if you are someone that's making up a scenario here, let's say you take a pill for a high blood pressure, oftentimes you can find medicine like that on GoodRx and CleverRx for less than $10 per month. So when you get to the pricing, I think you'll see how financially there's a few different ways to approach it to get the best price for you and your family. The second option, however, is the Advantage plan. The Advantage plan is the plan I am on because I do have rheumatoid arthritis and I have some ongoing care that I need. But just like the basic plan, it covers all your preventive care items 100%. It's everything, like I mentioned earlier, from your annual physical to childhood immunizations to colonoscopies and mammograms and everything in between. The Advantage plan does have copayments as well for any ongoing care you might have. So if you go to your primary care doctor, it's a $20 copay. When I go to my rheumatologist, it's a $50 copay. When I get my blood work done, it's a $50 copay. And then this is also the prescription drug program I mentioned prior. If you recall back to that slide I had up just a few minutes ago that had curative medicines on the left and maintenance medicines on the right, generally your maintenance medicines, like mine, fall in tiers 1, 2, or 3. One of the medicines I take is a tier 1, the others are tier 3, for example. Your curative medicines are generally in tiers 4, 5, and 6, and those will be shared through SEDERA and part of that IUA that we discussed. There are exceptions to that, of course. The one that I've run into over the last year or two that I can recall was a woman whose husband suffered from seizures. Just the nature of the medicine he took, it was actually tier 4, 5, or 6. It was a higher tier medicine. And so the most affordable way for them to get that medicine was actually through a third-party Liberty benefits. But like I said, generally speaking, your maintenance medicines are in tiers 1, 2, and 3. Also, like I mentioned just briefly, the most common question we get is on pre-existing conditions and the restrictions that surround them. But the second most common question is on prescriptions. So for anyone that takes a prescription, feel free to reach out to us. We can look up your prescription. We can make sure, A, that it's covered, B, tell you what tier it's in, and then 3, tell you what the cost is at a number of pharmacies in your local area. So if you're on prescriptions, again, feel free to reach out to us. We can discuss it. We definitely want to make sure that folks are as well educated on what the program is and what the costs are and what the program is not, and everyone is well aware of how it works. And again, at the end of the presentation, you'll see our contact information. Feel free to shoot us an email. We can get on the phone with you or your staff or your family or whoever it might be and discuss it in detail. Now, when I talk about SEDERA and medical cost sharing, I made sure to note that it's network independent. You go to any doctor you'd like or hospital you'd like to get the care that you need. When you go to use your Apex plan, however, they do use a network. They use the Multiplan Network. The Multiplan Network is actually the largest network in the U.S. There are more than 900,000 doctors participating in the network and tens of thousands of facilities. It's a nationwide plan, and Multiplan, like I said, is not only the biggest in the U.S., but it's also the most flexible and one of the best paying networks. So hospitals and doctors certainly do join. On the FCICA website, there are directions on how to search the network. The only direction I'd give you on searching that network is to not search necessarily for your doctor's name, search more for the specialty. And the reason is that some doctors register to the network through the practice name, some doctors register as an individual. So the best way to actually search the network is just to search by specialty, or you can actually run an overall directory. And all those directions are on the FCICA website, or like I said, shoot us an email. We can send you a directory for your local zip code and surrounding area. But let's talk pricing. This first slide is obviously for the Apex plans. On the left, you can see if you enrolled as an individual or member only, or you and your spouse, or you and just the kids, or you and the entire family, meaning spouse and children. That second column there is for the basic plan. Again, the basic plan covers all your preventive care items 100%, but that's really it. But it does meet the government's requirements for a health savings account. You see it starts at $71 and goes to $102. Then that third column, there's the Advantage plan. Again, the Advantage plan has the prescription drug program, the co-payment structure for ongoing care, and of course covers all your preventive care items 100%. And you should have red arrow. That's actually just the plan I'm on, and I'll refer back to that in just a minute or two. Once you pick the Apex plan that best fits you and your family, you would pair that with the SEDERA membership. For space reasons, we only have 2 of the IUAs listed here, but on the FCICA website, of course, they are all there. But again, there's the $500 IUA, the $1,000 IUA, $1,500, $2,500, and $5,000 IUA. On the left, MO is member only, MS is member and spouse, MC is member and just the kids, and MF is member and the entire family, meaning spouse and children. For SEDERA, it's been banded across the top by age, as you can see there, for those in their 20s, 30s, 40s, 50s, and 60s. And again, the 2 most popular IUAs are the $1,000 and $1,500 IUA. And you can see that red arrow there again. That's just the IUA I am on for 175.51. So here's an example case for everyone who made the same decisions I did and was also in their 40s. and that is the Advantage plan for the reasons discussed with the ongoing care that I need. And the Sedera $1,500 IUA, which again means if I were to need surgery tomorrow, my out-of-pocket cost would be $1,500, and I'm responsible for the first 3 needs in the calendar year. After that would be at a $0 IUA. And so my monthly total is $320, which saved me around 55%. I'm in the DC area, right outside DC in Maryland. Folks that are more rural areas, we have Colorado, Alaska, and elsewhere, they're saving 75, 80%. But again, the average nationwide is right around 60%. And again, the benefit there of the IUAs being on a per need basis rather than the calendar year basis that many of us have had with our deductibles simply means that if I have to use my Sedera membership tomorrow, I'm responsible for the first $1,500 rather than on traditional insurance where I'd have to meet that deductible 100% before it really kicked in. On the FCICA website, there's a wealth of information. There's actually a video that uses the exact same slide deck we're going through now. There's a couple of videos out there, but there's all the current rate sheets. There's details on Sedera and their sharing guidelines, details on the Apex plans. There's a great FAQ on telemedicine. So even if you've never used telemedicine, even if you're not going to sign up for our program, if you're interested in learning how telemedicine works, there's a great FAQ on the Teledoc section on the website. And then, of course, SecondMD, and like I mentioned, how to search the Multiplan Network. 2 more slides. The program itself is available right now in 45 states. It's not currently available in Vermont, Washington, New York, and Illinois. I apologize. It's available in 46 states. It's currently now available in Alaska. I apologize. I didn't get that updated into the slide deck. Washington, New York, and Illinois will be freed up next, and then Vermont. The program itself does not need an employer sponsor, so individual employees can join, full-time, part-time, seasonal, hourly, or salaried staff. The monthly cost can be paid by the employee or the employer. One caveat there, of course, is that you need to be a member of FCICA. If you're an employer and you're looking to offer this to your staff, send us an email. There's a simple 1-page form we send you with your demographic and billing information. We then set up a dedicated enrollment site for you and your staff to use. If you're an individual, or if you're an employer who just wants to make this available to your staff on an individual basis, you can simply enroll directly from the FCICA website. You'll see an Enroll Now button. You click on that and you follow through. One last item there is a dental option that you can also see on the website. We don't spend too much time talking about it. To be honest, it's not going to save you any money over any other dental plan. It's almost exactly what I pay now for my Blue Cross Blue Shield plan, except the program that we offer is on the Aetna network. And it sets up just like any other dental program you've ever had, where it covers all your preventive care items 100%, and then has an annual cap for additional services like root canals and caps and whatnot. Lastly, our contact information. Email's probably best right now because we're a distributed company and working from home, but either one will put you right into our help desk, and folks will get back to you generally in a couple of hours business time. Feel free to reach out to us anytime. Like I said, the 2 most common questions that we get are around pre-existing conditions, and the second being prescriptions. So if you want to talk to us one-on-one, or if you want to talk to us with you and your family, or if you and your employees, just reach out to us, let us know. We'll set up a call, and we'll go through all that with you. But with that, Christine, I'm going to throw this back to you. And I guess actually we can answer the questions. I'll go through the questions if you like.
Sure. Yeah. Thank you so much, Kevin. If the audience has any questions or comments, please submit them in the question box on the left of your screen. We'll wait a moment for people to enter their questions. In the meantime, actually, there's some questions that have come through. And the first one is testing for COVID included?
Absolutely. The way testing with COVID works is you simply have to show up with your Apex card. And I did skip that. With Sedera, like I mentioned, you do not get a card, but with Apex you do, just like you have now with your insurance company. So you show up to any testing site with your Apex card, and that's all you need to do. If I could just circle back to that, because I did miss that when I was going through, you do get a card like you have now with Apex, and you present it with your doctor's office or wherever you might go with it and pay the copay if you have the Advantage plan. Again, on Sedera, you do not get a card because you're a cash pay patient. In fact, one of the best ways to look at the difference between Apex and Sedera covers, or Sedera, you can share through Sedera everything that happens with the hospital, if you will, and then some things that happen outside, of course. But with Apex, they don't cover anything that happens inside the hospital. So oftentimes that's the best way to look at that. And actually, I see that's the next question as well. So I guess I answered that one as well.
Okay. Sorry. Go ahead, Kevin.
That's okay. One other thing that I really just skipped through, folks, is our cutoff. We have rolling enrollment, meaning that people can enroll at any time during the year. They can also leave at any time during the year. But the 18th is the day to keep in mind. So for folks that enroll, for example, by November 18th, their first day will be December 1st. Folks that enroll between November 19th and December 18th, their first date will be January 1st. Also, you don't have to commit to a year or anything like that. That's why it works well for seasonal workers or even people who just need a bridge at a time for their health care. Go ahead, Christine.
Okay. A question is, how can we verify our current prescriptions are covered under this program?
You really need to reach out to us for that. There's not a way that you can do it online, but if you can reach out to us. We can do it over the phone or through email, and we can look up your prescription, like I mentioned, make sure it's covered, and then we'd have to get back to you. But unfortunately, that is something that we need to look up on your behalf.
Okay. And another question is, you may have touched on this, but can you explain the network Apex uses and how we can see if our doctors are in the network?
Yeah, absolutely. You can email us, of course, or on the FCICA website under the Apex tab. About halfway down, I think, it says network search directions or something to that effect. You just click on there and you can go through and search. But if you want to just shoot us an email, feel free to do so. We can run a full directory for your local zip code and surrounding area. And I apologize for the dog growling in the background. Any other questions?
I think that's it, unless anybody else has any other questions and you want to add them to the Q&A box. But I think that's it, Kevin.
Okay.
So thank you so much.
If you think of a question later, or if you think of a question next week, that email that's on your screen, folks, just shoot us an email. We will we'll get right back to you.
Absolutely. So if there aren't any more questions, then on behalf of FCICA, thank you so much, Kevin, for presenting today's webinar, the SALA Healthcare Program. This is the conclusion of the webinar. Thank you so much for joining us, and have a great rest of your day.
Thanks, everyone.
Thank you, Kevin.